So after a long study and much thought and personal conviction, each and every one who is a Jehovah's Witness has come to this conclusion of his own, through his own personal study of how he wishes to serve God. So now you get the situation like what happened with us, where now I didn't really need a doctor. I was a healthy young girl, and now I'm pregnant and I need a doctor. So you know, now for the first time for me, I had to confront men who are trained and qualified, and I'm just a little old housewife. And yet I want them to help me, but please don't use blood on me. How are they going to react? Some of them panicked, and I actually ended up being...
Did you panic?
Not at all.
Once you knew you were RH negative and...
No, well, I think my heart sank a bit, thinking, oh, you know, did it have to be complicated? But you know, obviously, if you're a person who's got a relationship with God, then you have your blows in life and your confrontations and your challenges, and they're a matter that you talk to Him about and ask for guidance.
You never doubted that maybe you'd have to change?
No.
No. It didn't occur to you?
No. When I tell you more about this other experience, you'll see how one's faith actually is basically tested, I'd say, because you know, you don't really know how you're going to react until the thing hits you, do you? You can plan your strategy ahead of time.
Have you ever heard of anyone who's refused a transfusion and then has died, or their child has died?
Yes. I personally don't know of anyone personally, but I mean, in our Watchtown Awake magazines, there are many reports, you know, of the situation worldwide and how different doctors have handled it.
So it's not always necessary that you believe you'll be saved.
No, never to presume. Yes. In fact, if since you've brought that up, when I wrote down my experience at this hospital, I'll give you the kind of thinking that I had. It says, in my heart and prayers, I constantly begged Jehovah for a successful outcome. To this case, I had the most recent one, which I'll still tell you about. But at the same time, there was never a question of my willingness to die in loyalty to Him. I became happy to adopt the attitude expressed by Daniel's 3 companions in Daniel 3, where they said, if it is to be, our God whom we are serving is able to rescue us. But if not, let it become known to you, O King Nebuchadnezzar, who they were talking to, that your gods are not the ones we are serving, and the image of gold that you have set up, we're not going to buckle down on this. So that was my of course I would ask God for, but I mean, I didn't presume that I would be important enough to be rescued. You know, He asked Abraham to sacrifice his son. I don't think I'm better than Abraham. So I'm prepared to go through. No, I learned wonderful lessons there because, well, let me outline the story to you and then you can see how it developed. First of all, I ended up there at Johannesburg with my first pregnancy, looking for a doctor that wouldn't panic, because understandably this is replacing a bit of a restriction on the doctor. Yeah. So, but you want someone that's willing to take that risk and let you take the consequences, which you now understand. I think it's very important for doctors to explain properly to their patients what are the possible outcomes to the best of their ability. One can never say for sure, but patients must be informed, and I found there was a lack in that.
They didn't want to tell you what are.
They are basically medical gods, they would like to think. Some of them, I'm saying this is the attitude the patient gets, and you're just an ignoramus. Which you are. You're totally the world of medicine is a wonderful world you know nothing about. But basically, it's rather like if you came into millions, but you know nothing about handling money. The best thing you could do is go to a financial advisor and say, hey, look, I've just inherited these millions. What do I do with them? Do I invest them? Do I buy property? What do I do? And he says, well, look, looking at your lifestyle, looking at your skills, I suggest, as an expert, that you look at these 3 fields. And now he must inform you what those 3 fields mean and leave you to make the decision as to where you would like to invest your money. Now, he might think that A is better than B or C, but you personally choose B. Now, you go back to him and say, I choose plan B. And he said, well, a bit of a pity because plan A would have worked much better for her, but it's her choice. It's her money in the end. And this is the same similar sort of syndrome that we're looking at with doctors. We need them. We need their skill. We need their expertise. We need their courage. But can we just have the last say over what's done with our body, sort of thing? This is our conviction. The most important thing, Carol, too, is that we're not trying to persuade others to agree with our view. This is my personal conviction, you know. And it's not because I belong to a church that says thou shalt not. I'm not loyal to a church. You know, I've studied this in the Bible. I've read it. I know where it is. I understand that. Yes, well, the interesting thing is the minute I met Justice now at hospital, at Johannesburg Hospital, I went to his unit because he started that natural childbirth unit, and there I figured was a doctor willing to give women freedom to deliver how they want to on your head if you want to. Wouldn't I therefore also be given the freedom there to have treatment the way I'd like it to be? That's why I chose him, all right, and in between him, I had the doctor first who panicked, and then I had an over-casual doctor. When I changed to another day to try and find another doctor, it's the only way you can do it, over-casual. When I said to him, now look, there is a problem. I have negative blood, was the only part I know about it so far, and I would not like any blood to be used as any medical remedy for me. You know, oh no, my dear, you know, for goodness sake, don't worry about that. No, we'll never. And I thought, no, that's too casual. And when we met Justice and explained the situation to him, immediately he understood. And he asked a question which I think he could verify. He's asked of all witnesses, how strong are your convictions? And he's always had the same answer. It's non-negotiable. Non-blood management, it's non-negotiable. Fine, he said, and then he still went to the trouble, and in those days there weren't, this is now 9 years ago, there were not forms and things available to relieve the hospital of liability. He invented a form, so to say. He found some paper and he made amendments to it, and we signed an agreement, and I felt, well, here was a man who was taking this thing seriously and making the provision for us and willing to handle us on that basis.